This video continues Chapter 7, and our objectives here are to work through that first part of primary patient assessment principally, and specifically what we're going to see if we encounter a patient who is responsive. Now, a couple of key terms, level of responsiveness and the AVPU scale. We'll pay attention to those. For patient assessment, remember there's 5 key pieces, beginning with the scene size up, primary patient assessment. Later we'll learn about taking a patient history, a secondary assessment with head-to-toe physical exam and vital signs, and then a reassessment. I can't emphasize enough that this needs to be systematic and standardized for every patient you encounter. For primary patient assessment, we're just going to focus right now on the level of responsiveness. Is the person alert and able to communicate? That's a good thing. If someone can speak normally and you don't have any major bleeding, you know that their airway and breathing are intact, their airway is patent, and we also know something about the idea of their level of responsiveness. Now, specifically focusing on that, for a fully responsive patient, make sure that you introduce yourself to the patient and ask for permission to help. Remember, we need to establish consent when we're dealing with a patient. You might just simply say, "Hi, I'm Paul with the Ski Patrol. Can I help you?" If it's a minor patient, make sure that you get minor consent from a parent or guardian nearby. If a patient is unresponsive or a child who is alone, you're operating under implied consent. Now, with that patient, put them at ease, talk in a very calm, professional manner, but avoid telling them that they'll be all right. Remember, a patient can refuse care, and in that case, we need to respect their wishes. Now, if you are concerned about the patient, just stay nearby and understand that a patient may initially refuse care, but only decide later that they need help. It helps to get down to the patient's level on the snow and make eye contact. You're still going to be kind of working through some scene size up, getting a general impression of the patient and their initial appearance. Now, you might also consider simultaneously assessing their patient's pulse, not as we would in a secondary assessment for rate, but just for presence and adequacy. Is the pulse fast, indicating that maybe their fight or flight response has kicked in? Or is it slow? Are they calm? Is that pulse strong, or is it weak or thready? Assess those just for presence and adequacy. Now, for a patient who is not completely responsiveness, we need to assess the level of responsiveness, and we need to understand that that just kind of exists over a range. One of the things that we can use, we'll see in just a couple of slides, is that continuum goes through what we call the AVPU scale. Another way, however, to consider level of responsiveness is to question the patient and do it in this order. What's your name? Can you tell me where you're at? About what time is it and what day of the week? Tell me what happened, the events leading up to the situation. If a patient can answer all of those questions correctly, we can say that they are A and O times 4. They are alert and oriented to 4 things: person, place, time, and event. Now, if they're unable to answer those questions, then we have the potential for some neurological problem. Could be due to a brain injury or hypoxia or any other set of medical conditions. Perhaps they're having a diabetic emergency. Now, the common quick way to assess a patient's level of responsiveness is with the AVPU scale. And at the highest level of the scale, a patient is fully alert. Their responsiveness, they're moving their eyes, and they're aware of their surroundings. If a patient does not open their eyes spontaneously, but they respond to your verbal prompts, we'd say they are V on the AVPU scale, verbal. Sometimes they'll respond only to painful stimuli, such as a trapezius pinch. And if they don't respond to any type of stimulus, they're unresponsive. Now there's an alternative called the Glasgow Coma Scale. And the Glasgow Coma Scale relies on a scale of up to 15 possible points. To assess a patient using the AVPU scale, see if they're awake and alert, and then instantly you know they're A. If they're not alert or their eyes are closed, they're going to be further down on the AVPU scale. If a patient does not respond to the verbal stimuli, you can pinch the earlobe or apply a trapezius pinch to rate them then as a P. Anything less than that is going to be unresponsive. In summary, as part of your primary assessment, it's important to assess the level of responsiveness. If a person is alert and able to communicate, we know that the airway, breathing, and circulation are likely intact.